Morning, everyone. I want to take you back to a time we all remember vividly. A time of uncertainty, of fear, of empty streets and overflowing hospitals. The COVID 19 pandemic wasn't just a health crisis, it was a crisis of information. It showed us with devastating clarity how quickly a new pathogen can circle the globe and how critical early detection truly is. But this isn't just about a once in a century pandemic. Every year, familiar enemies re-emerge: dengue, malaria, cholera, and COVID, many more. These outbreaks stretch our healthcare systems to their limits, and in this battle, the gap between preparedness and crisis is measured in days and sometimes even in hours. This is the problem we are here to solve. We, a team of four of PathoSpec, including myself, Sumit, Shravan, and Shashank, and our mission is to build a future where we see outbreaks coming and where every single person, no matter where they live, is protected.
In order to overcome these consequences, early breakouts of diseases, widespread of diseases across countries, showing hotspots, 60 to 80% of the population affected. The people in the cities to know fast as they have a connectivity, social media, and internet. Uh, but what about the rural India? What about the village with limited connectivity? How do they come to know? The is they often don't, not until it's too late. These this information delay has a tragic human cost. Children, the elderly people, the vulnerable population are affected first. The fever is treated as a fever until it's a cluster. A cluster becomes a pandemic. Later, the detection in these areas means life-saving resources are misallocated, wasted, and arrive too late to contain the threat. The traditional outbreak detection is slow, reactive. Samples are collected, sent to lab, research is conducted, the reports are manually filled. This process takes an entire week or months to detect.
So, this is where PathoSpec changes the entire model or a system. We are moving from reaction to prediction. So, how does it work? PathoSpec is an intelligent, connected ecosystem. It starts at the source. We equip primary health centers, even in the most remote areas, with simple tools to report symptoms and initial diagnostic data.
PathoSpec does not just store data, it analyzes it. It cross references symptoms, clusters, water quality reports, mosquito density data, historical outbreak patterns. As you can see from this architectural diagram, the flow is designed for speed and scale, from data injections of PHC level through the secure data pipelines to our AI analysis engine and finally to our user facing dashboard. Our methodology is built on multi-layered approach: disease detection, predictive modeling, and real-time GIS mapping. We don't just tell what is happening, we tell you where it is happening and where it is likely to go next.
This is what the health official sees: the PathoSpec dashboard. It's not just a collection of data, it's a command center. It shows emerging hotspots, predicts the outbreak's peak, and helps officials visualize the spread. Now, a critical question. If we detect an alert, how do we notify these rural villagers who don't have smartphones? This is a key part of our design. The alert doesn't go to the public, that would cause panic. So, first, it goes directly to the district medical officer and the doctors at the local PHCs. They receive a clear, actionable intelligence brief on their mobile devices. Second, they are now empowered. The PHC doctors, the local doctors, they can tell villagers that we are seeing a rise in this illness. Please take these specific precautions.
This entire process, from rural doctor detecting a symptom to district level alert, is managed by our robust data pipeline, ensuring data integrity and speed every step of our way. Because of AI analysis, the rate of spread, it can accurately model the outbreak's trajectory and predict its peak. This is crucial for resource management, knowing when and where to send nurses, doctors, and medicines for the patients. Everything is visible on our dashboard: current cases, predicted spreads, resource availability, and alert status. The benefits are clear. Earlier detection of PathoSpecs means we can move to the controlled and prevention areas.
This is the future we are building. A future with more green zones where life is safe and normal, and fewer red alert zones where life is on hold. To put it simply, the traditional method is slow, manual, and reactive. It leads to overwhelmed systems. The AI driven PathoSpec method is real time, predictive, and proactive. It leads to controlled, managed responses.
For those who are interested in technical specifics, the diagram shows our stacks. For front end, we use React.js plus Next.js. For the backend, we use Node.js plus Express. For the database, we are using MongoDB. And for training the models, we are using Scikit-learn plus Panda. For the notification, we'll use Twilio. And for version control, we are using GitHub and Git. Predictive capability is our greatest asset. By identifying an outbreak at day 1 instead of day 20, we fundamentally change the outcome. Ultimately, this is our goal: a safer, healthier India, where our postcode does not determine your access to life saving information.
Lastly, to sum it up, PathoSpec is more than just a software platform. It is a new nervous system for our nation's public health. It's a commitment that we will never again be caught unprepared. Our future goal is to integrate this system at a national level, creating a unified defense grid against all pathogenic threats. Thank you for your time. We are Team PathoSpec, predicting outbreaks before they strike for a safer, healthier future.